So I think everyone acknowledged, well, I shouldn't say everyone, I think the general consensus was that calving in confinement presents a little more challenges than calving in pasture. I don't know that that, again, was an absolute agreement. Based upon the discussion we had yesterday, there were some folks who actually expressed a preference to calving in confinement because of the control that that permits. But generally, as the comment was made, I believe it applies that you do have this concern about what are you going to do with the deads, because it does have a tremendous impact on it. And so that's what I'm going to try to talk about. I don't have data per se that a lot of the other folks do. I think there's a lot of opportunities here for data to be created and specialized regarding this, but I do have hopefully what you'll interpret as evidence-based suggestions for how to go about this, and that's driven from some extrapolations from pasture work and some intensive management of beef, but also some dairy work as well. So that's what we're gonna strive to achieve here, and I'll tone down a little bit since we're definitely mic'd up now. So what we're going to look at is the calving process itself, and then speak quite a bit about colostrum, the environment at which we can create and to the extent that we can control it, and then just kind of this other management issues. And then to me, I'm a numbers guy, and so I like to, the statement is you can't control what you can't measure. And so we're going to give some targets for monitoring and how you can assess how you're doing on all of these things. And then if time permits, when we get to the end, I'm going to have just a very modest statement about treatments, but I intentionally am making that a very trivial portion of the discussion, because ultimately we're going to be a whole lot better off to prevent these problems and try to manage them after they develop. And these principles, these principles apply largely across the board, wherever you're managing, whether you're doing a semi-confinement or semi-controlled environment, as was said yesterday, or whether you're doing calving truly in a confinement or a controlled environment area. But again, the challenges certainly step up the more intensive you get in that. And these things that would be great to do in any situation largely become imperative when you create a situation where you're much more intensive environment. From the calving discussion, the difficult calving, dystocia, is termed a dystocia. I'm guessing everyone's familiar with that term. The causes for dystocia: fetal pelvic mismatch, just meaning basically the calf is too big to come through the dam's pelvis without difficulty or without assistance. That's primarily an issue in heifers, and that's certainly genetically driven and genetically influenced, also influenced by how well the heifer has been developed up to the time of calving. So if you're talking about having a truly from birth and retaining heifers and an in perpetuity system, then this is an issue that you need to be managing. But that's not really any different than what we manage in a typical conventional production system. If we're talking about buying those cows that have basically no teeth left in their head and just trying to get a couple more calves out of them, then fetal pelvic mismatch ought to be not an issue or a very trivial contributor to any sorts of problems. Another cause of dystocia is malpositioning, where the calf has a leg back, a head back, a true breech, something like that. That is primarily bad luck. If you have true fetal pelvic mismatch and that calf is just too big for that calf's going to figure out somewhere to put its body parts, and so fetal pelvic mismatch can contribute to malpositioning, but it does happen totally independent of that. And so really, I can't make any recommendations to that in how you control that. You're just going to have to manage those when they come. The one that I want to spend a little time talking about is this idea of failure to progress, that the cow is at a physiologic point where they're ready to calve, but they don't go through the calving process appropriately enough and quickly enough. And hopefully everyone's familiar with the phrasing that the calf determines the day the dam determines the hour of calving. And so if you have that calf is basically kicking off that hypothalamic axis that says, hey, I'm getting stressed in here, I'm too cramped, I need to get out. But that cow can say, yeah, but there's some coyotes sitting on the hill over there, and I'm not going to do that right now. And if that cow delays that long enough, then that poses a significant risk to that calf, to that calf's well-being. So that's what I want to talk about. And why do we talk about that, or why is that more of an issue in an intensive calving situation? Well, work has been done to show that disturbance of that animal and close observation of an animal that's not acclimated to that will lead to dystocia. This was shown in heifers, but from personal experience and from my observations, I have no doubt that the same is going to manifest in cows. And in fact, we have seen in a dairy environment that disruption of labor through movement or through more intensive interference with that process also delays progression and increases complications, dystocia, retained placentas, and those kind of things. So when you create an environment that is not typical or not traditional for that cow to calve in, she may demonstrate more of this issue of this failure to progress. And that plays into this third point of cows will seek to isolate and shelter during that time of dystocia. And if they don't have any opportunity to isolate themselves from the rest of the herd, to isolate themselves from human observation, human intervention, then you may have this emergence of failure to progress problem. How can we address that? We acclimate these cows in the environment prior to parturition, or calve in pasture, as many folks have talked about, or calve outside of that confinement situation, where those cows can demonstrate that normal behavior that they would otherwise, and you're not going to interfere with that. This acclimating cows still, it was even discussed yesterday about, or today, of developing a line that's docile, easy to deal with, and comfortable in this environment, similar to what we've done with the dairy breeding. And so that can certainly be overcome. But again, if you're going to the sale barn and you're buying that kaleidoscope of cows, as was described yesterday, and you're buying them just because there's an opportunity to get a calf out of them, you may be buying this type of problem. Certainly, we're going to recommend avoid moving at impending parturition. Again, that's seen even with animals like dairy cattle that are very accustomed to being handled, where if we have them in a dry lot, and then we say, oh, she's getting ready to drop the calf, and we're going to now move her to the calving pen, we're going to potentially create problems with that. And so we certainly want to avoid that in this beef production system as well. And then the final one is, I would suggest that if you encounter this, and this is a problem, and you're going to calve in confinement, and you're seeing this type of issue, then maybe consider providing a sheltered area within the pen. And this comes directly out of this third citation down here, Proudfoot work, where they had built this structure. This is applicable to dairy. This is from dairy work, but I certainly believe it'd be applicable to beef, where they created a structure where that cow could navigate herself into that confined area down here. She could still see the other cows. That's the purpose of this here, is to where she could still see the other cows and not feel completely alone, but she was isolated in a fairly natural approach, or at least what she deemed fairly natural approach. And that was very highly selected by these dairy cows to choose to do that. And so if you're seeing some issues with failure to progress, that may be one means of managing that. Once we get the calf on the ground, and hopefully without problems and without delay, now we have to look at getting colostrum into them. And that's of immense importance. Colostrum, the term being given for the first milk, and it's important for a variety of reasons, the largest of which is it provides passive immunity. Passive immunity meaning that you're providing immunity to that calf, that calf doesn't have to build on its own. And that's very important for cattle, because those calves hopefully have not been exposed to any infectious agents while they're in utero, and have not developed any immunity on their own, and they've also not acquired passive immunity through their placentation. So that calf is truly immunologically naive at the time of birth, and the consumption of colostrum is going to give them the opportunity to deal with things that they're going to encounter very early in life, and for that first 4 to 6 weeks until they can get their immunologic legs underneath of them and get moving along. The most important component, or at least the best characterized and the easiest to measure, are immunoglobulins or antibodies. That's the two terms for the same idea, same compounds. The most important even of the immunoglobulins is IgG, and specifically IgG1. That doesn't matter other than depending on how you want to go about assessing failure of passive transfer, you may get slightly different values and slightly different terms. But immunoglobulins, antibodies mean the same thing. But there are other important things that the calf derives from colostrum as well, including some cellular components that actually cells from the cow are in the milk and enter into the calf's gut and actually get absorbed out of that calf's gut intact, still viable, and enter into the calf circulation. And that plays a seemingly important role in, again, making that calf more resilient in those early days and early weeks of life. But that's not absolutely essential, because we know we can handle that colostrum in a way that would kill those cells, but that calf still benefits from the antibodies. And then also colostrum is highly nutrient dense, and so it gives that first meal to that calf that gives it the energy to get up and do what it's supposed to do and get a good start off into life. Because the antibodies are the most well characterized and easiest to measure, that's how we're going to assess adequacy of passive transfer. And so the antibodies that are absorbed by the calf into its bloodstream is simply characterized through this equation of, first of all, how many antibodies are in the colostrum as a concentration, how many grams of antibody per liter or milligrams per deciliter. Then how much of that colostrum does a calf eat? And then how well absorbed is it? And so we're looking at concentration or quality, volume or quantity, and then efficiency of absorption of those from the gut. And all three of those have to work reasonably well in order for the calf to get adequate passive transfer. So we're going to walk through each of those components. I think everyone will recognize that quality of colostrum is impacted by the parity of the dam, how old she is, how many calves she's had. It's probably poorest in that first calf heifer because she just hasn't lived all that long of a life. She hasn't encountered that many pathogens, and she hasn't developed that strong immunity. It gets better in a 3-year-old, generally considered maximum quality in a 4, 5, 6, maybe up to a 7-year-old, and then presumably you get some decline as those animals age, just from the ability to regenerate their lacteals and their mammary tissue. Also influenced by nutritional status. And this is something that I think we, at least in my fairly limited experience with cow-calf confinement operation, that we don't have a real good handle on. We know we can maintain the body condition score of those cows, and we know overall we feel like we're delivering good nutrition to them, but I'm glad to see the work that's being described at Texas A&M is being done to say how does it impact colostrum quality, passive transfer to the calf, and ultimately the calf's health as we limit feed these nutrients and those sorts of things, because that certainly does have the opportunity to have an impact. The other thing that a lot of folks will talk about is vaccination status. We need to vaccinate those cows in order to get their antibodies really high. And I'm going to tell you that that's pretty minor. That's actually a minor driver of the quality of colostrum, because there's antibodies in there that we couldn't even begin to characterize what they're against, what function they're going to play, how they're going to help that calf out, and they're going to be very important. So what we can vaccinate for is going to be much less important than what that cow is going to have already developed naturally. The quality of colostrum is also impacted by milk loss or leakage and time to collection or dilution. And the way that works is basically that a cow is only going to produce so much colostrum, and that process starts 2 to 3 weeks prior to calving, and it basically ends abruptly at the time of calving. And if she retains all of that colostrum over that 3-week process, then she's got good quality colostrum. If she has an injured teat or she has a very large udder and she gets pressure and she leaks that, she's not going to remake that colostrum. That colostrum's lost. It's gone. So that is that source of issue. The other would be if she has another calf that was described yesterday, that these calves will just attack cows, move from cow to cow to cow. If you're in a situation where that cow gets suckled prior to delivering a calf, then that colostrum's gone. She's not going to replace that colostrum. She's going to enter into lactation. And so when her calf hits the ground and gets his first milk, it's not her first milk, and he's going to pay the price for that. Similarly, the time to collection dilution, as I say, the creation of colostrum ends at calving. And so if that calf doesn't nurse until 12 hours or 18 hours or 24 hours, her body is already physiologically shifted to producing milk. And so now you're getting that colostrum diluted by milk. That's more of an issue in dairy cattle. That is a very real issue in dairy cattle, but it certainly is a feasible, it is conceivable issue in these cows as well. In terms of colostrum quantity, where we're going to, again, have a pretty good intuitive idea on most of these, I believe. Generally, breed, we're going to ascribe certain characteristics to breed. Now, it was mentioned this morning that those general characteristics of breeds have largely been washed out, and if you want a low milking Angus, you can find it. If you want an Angus that approximates a Holstein, you can find it. If you want a low milking Hereford, you can find it. If you want a high milking Hereford, good luck with that. But generally speaking, those breed issues have gotten reduced. Parity of dam is also an influencer of that, with those heifers producing low volumes of colostrum as well as relatively low quality of colostrum. So those heifers really are the biggest challenge. And then again, of course, nutrition plays a role in that as well. I've got this little caveat here at the bottom. It says quality and quantity are typically inversely related. The heifer is a violation of that. The heifer is going to produce lower quality and lower volume than she will as an older animal. But in general, when you have a heavier milking animal, they are only going to be able to put so many antibodies into the colostrum, and you're going to get this dilutional effect. If she's making more volume, you're just going to dilute those antibodies out. Again, that's very much a real issue in dairy, probably less of an issue in beef, but it certainly can be conceivably an issue. We're not just concerned, however, with the amount produced or the quality produced, but the amount and quality consumed by the calf. And so just like we said, what is consumed is going to be influenced by whether that cow had been suckled by another calf or had leakage. You're going to have the same issues here as far as how much is going to be consumed by that calf. It's going to be influenced by the vigor of the calf, as well as the teat conformation of the cow and the mothering ability and the anxiety of the dam. And that plays into, again, to having these cows that are not comfortable in that environment, doesn't exactly know what she's doing, or doesn't take to that calf quite as well as she should. And so she's going to interfere with that calf's ability to get up and nurse early, and then you start getting into that dilutional issue potentially playing a role again. In terms of the efficiency of colostrum absorption, time is the primary driver. Time. That's the most important thing. How early, how quickly does that calf consume that colostrum? There are actually special enterocytes, special cells in the calf's gut that absorb those antibodies and those immune components, and the longer that calf lives, the fewer of those specialized cells remain. And so the absorption is by far the greatest in the first 4 hours of life, and then begins deteriorating after that. Has been notably impacted by the time that calf is 12 hours of age, and basically ends by the time that calf's 24 hours. Now, if that calf truly ate nothing up to 24 hours of age, some of those cells are going to be present. Basically, they're signaled not only by time, but also some things going through the gut. So you do have a little bit of a preserved window there if that calf did not get up and have an opportunity to nurse. But realistically, you ought to assume that they're not going to absorb any antibodies after 24 hours of age. So you've got to get that calf to the udder as quickly as possible. The efficiency of absorption is also at least theoretically influenced by other things that, again, go beyond just the quality and the quantity of what they're consuming. We're not just talking about getting the colostrum into the calf anymore. We're actually talking about getting the colostrum out of the gut of the calf and into the body of the calf, which is where it needs to be to actually function. And how well that is done, as I just said, is influenced by time, but is also at least theoretically influenced by some other characteristics and other events. So dystocia has been shown to impact efficiency of absorption. That is both the general overall vigor of the calf and how soon that calf is going to get up and how vigorously it's going to nurse and hit that 4-hour window, but also by hypoxia and acidosis. So if that calf is saying, hey mom, I need to get out of here, this environment no longer works for me, and she's saying, nope, nope, you need to hang in there a little bit longer, that calf now starts suffering from an inadequate supply of oxygen and starts developing an acidotic environment. And systemically, we know that that has some impact on the ability of that calf to absorb colostrum. These other things are sort of theoretical. It was been looked at in a dairy situation where we pull that calf away from the dam shortly after birth, and we may tube that calf through it with an esophageal feeder. There's been some theories that, well, gee, that calf's not going to absorb those immunoglobulins as well as if that calf suckled in the presence of mom, and there's some work to suggest that's true, but that's probably not a major driver of failure of passive transfer. The final one here is bacterial contamination of colostrum. That actually impacts efficiency of absorption. If you have a very highly contaminated colostrum sample, even if it has lots of antibodies present, if it's highly contaminated, that calf's not going to absorb those antibodies as efficiently and effectively as it would otherwise. This, when I talk about this, I'm talking about a collection and administration, not an intramammary infection. If you have mastitis in the cow, you are going to have lower quality colostrum, obviously, but that's a whole separate issue that should be a very minimal problem. I'm talking about a situation now where, for whatever reason, you have colostrum outside of a calf, or excuse me, outside of a cow, and you've taken the role and the responsibility of getting it into the calf. If you allow that colostrum to become contaminated, then you are going to reduce the amount of antibodies that that calf is ultimately going to acquire. So what kind of quality do we want? Well, as good as possible. What quantity do we want? As much as possible. And time? As soon as possible. But we're going to have to put some benchmarks on that, and that's going to come under my monitoring section as far as specific things, how you can assess how much is enough and when and that sort of thing. But this is the overall attitude that you ought to have in there. How, just qualitatively, how can you assess that, short of hanging a number on it? One, you just have to be observant. Look for mismothering, look for cross-suckling, try to separate ages of calves, as was mentioned yesterday. You know, it's not typical for a 2-day-old calf or a 3-day-old calf to be out there shopping for udders. That does tend to come along as that calf gets a little bit older, but the mismothering is something that you can see where a cow knows that she's about to go into labor, and all of a sudden her maternal hormones are kicking in, and she sees another calf on the ground and she goes, I want to mother that calf. And she will steal that calf from another cow, and then you get a colostrum issue arising from that. Monitor your teat and udder conformation, recognizing if that udder is hung real low, that calf instinctively is not going to put its nose all the way down on the ground and do this. It's going to go up into the flank. So those really low slung udders are going to interfere with that calf's ability to find that and get milk out of that. Another thing you can look at is time from delivery until that calf achieves sternal recumbency, sitting up on its chest, holding its head up. That should take place as quickly as 15 minutes. And it's been shown that if the calf is still in lateral or unable to hold its head up, it's not getting into that more natural position within 15 minutes, that calf's at great risk for not achieving adequate passive transfer, and that's a calf that you probably ought to look at coming in and intervening in. A second step on that is if you can't track that 15-minute thing, then you ought to at least be looking to see, is that calf making efforts to rise, making efforts to suckle? Is that cow demonstrating appropriate mothering behavior, at least within those first 4 hours? Because beyond that, that absorption window is decreasing. What if you're not comfortable that the dam is going to provide adequate passive transfer to the calf? What options do you have to assist that? Well, you can bring that cow up and you can collect the colostrum from the cow and administer it to the calf. That's pretty labor intensive, requires facilities that's going to allow you to do that, and probably not an ideal option. You could collect from other cows. You could have those high producing cows that you say, she's already given colostrum to her calf, I'm going to go and milk her out and then I'm going to store that colostrum. Again, probably not very realistic, but is an option. You can purchase from a dairy. Dairies generally have an abundance of colostrum and it's available to be purchased, and that's a very viable option. And then the final is the colostrum replacement products. And those are commercially available products that are lyophilized, freeze-dried, dehydrated in some form or fashion. Just come in a packet, you mix them up with water, and then you have a colostrum replacement product. All of those are options. I'm going to talk specifically about the last two because I think those are the most realistic options. The pictures here are showing a colostrum management system that's been widely adopted by progressive dairies, where they will collect colostrum, they'll test it for quality, they'll put it into packages, basically a plastic bag that then goes inside this green tote, and that green tote spreads that plastic bag out, makes it nice and flat. That means that colostrum freezes relatively quickly and it thaws relatively quickly. Then they have this water bath that is specifically adapted to stack these things in and thaw that at an appropriate temperature and an appropriate rate. And then once it's thawed, then you've got an adapter on the bottom of it where you can hook an esophageal tube in and tube the calf and get the colostrum into it. So if this is something you find yourself doing a lot of, this is a kind of system that is certainly worthwhile to consider. If you're buying from a dairy, it's the kind of thing that you can cooperate that they're going to freeze it in this system, and then you can thaw it and administer it using that same system. And it really manages volume, and it helps you handle that colostrum right, which is very, very important. So if you are acquiring colostrum from dairies, you need to be proactive in ensuring how they're managing it. So you want to avoid pooling of colostrum. That's a bad idea. The idea of taking colostrum from all the cows that calve today and mixing it all together, that's a bad idea. They need to be keeping colostrum from an individual cow. They need to be assessing it. They need to throw away the low quality colostrum and only freeze the high quality colostrum or retain the high quality colostrum, and then make that available to sale to you, rather than saying, oh, well, we're going to put it all into a mix and we'll assume that it'll all be okay. They need to be testing and only retaining the higher quality. If they have a pasteurization system, pasteurization is great. That actually, pasteurization maybe counterintuitively increases efficiency of absorption because you've dropped that bacterial contamination. And that really, really is critical to how much of that antibodies this calf is going to be able to absorb. So pasteurization actually improves the quality of the colostrum that calf's going to get, as well as guarding against the other issues that come along with that. So if you find one that's pasteurized, that's great, but it does require some specialized equipment and some real good attention to detail to make pasteurization of colostrum possible. Otherwise, you make pudding that's just not going to work very well. And also, if you're acquiring colostrum from dairies, remember that caveat we put up earlier, that there's a relationship, an inverse relationship between quantity and quality. Those dairy cows make very large volumes of colostrum, and it's not nearly as high in concentration as beef cow colostrum. So that calf now has to consume a lot more colostrum from a dairy cow than it would have from that low milking Hereford. That low milking Hereford's still going to get enough antibodies into a lower volume of production compared to a Holstein who's going to have a very large volume. If you now go to a more dilute product, something from a Holstein or a Jersey, you have to drive up the overall quantity that's going into the calf. Whether you're collecting colostrum from the dam, collecting colostrum from your own other cows, or purchasing colostrum from a dairy, handling it appropriately becomes very, very important. You want to be clean and quick. The more contamination you have, the lower absorption of antibodies you have, as well as increasing the risk of disease. Milk is a great media for growing bacteria, and it's not going to be sterile. Even pasteurized is not sterile. So if you take that milk product and you put it on a room temperature environment on the shelf for 30 minutes, the bacterial levels in that milk are going to double within 30 minutes. It's a great media. So you need to handle it appropriately and get it administered cleanly and quickly. If you are doing this preemptively, then you can freeze it and you can store it for up to a year. If you are doing it just on a short-term basis, you can refrigerate it, but you have a much shorter window of life. I say 5 days here. I'm a little squeamish even about keeping it 5 days. It depends on, again, did you handle it cleanly at time of collection? Did you quickly get it refrigerated and those kind of things? You need to thaw it or warm it, even if it's only refrigerated. You need to get it up to that calf's body temperature, up to somewhere between 98 and 102 degrees. So it does have to be warmed. You need to do that in a controlled manner. If you overheat it, you're going to damage the immunoglobulins. If you do it too slowly, you're going to allow for bacterial proliferation. So you can warm it either in a water bath or a microwave. A water bath is actually preferred. The microwave, you're going to thaw some, and then you're going to keep overheating that if you're not careful, even while some remains frozen. And so if you're using a microwave, you may need to pour out some of it out of your container in order to only have the frozen product remaining and being exposed to the continued heating. In terms of replacements, please, if you remember anything, replacement, colostrum replacement. A colostrum replacement product is a replacer. A colostrum supplement product is a moneymaker for the manufacturer and a little more. Do not ever confuse those. A colostrum supplement will not achieve adequate passive transfer for a calf that's at risk of that. So you look at the label, make sure it is described as a replacer product. If you want to dig deeper into it, you can look at the parameters I have outlined here, but I know you're not going to remember that. Basically, that calf ought to be getting at least 150 grams, 200 grams would be ideal, and even more than that is better. So that may require multiple feedings. Just make sure you know what the product is, read the product label, and use it appropriately, but make sure that it is a replacer if that's what you're intending it to be for. All right, colostrum, really important. It's really, really critical. But it's also important to understand that failure of passive transfer is not a disease. We have plenty of calves that have failure of passive transfer that do just fine in life. Similarly, a calf that has gotten adequate passive transfer is not bulletproof. You can't subject them to every possible insult in the world and expect them to survive and thrive. It's important, but it is not a panacea. Which brings us to the epidemiologic triad. What else do we need to be looking at? Well, the epidemiologic triad says disease and health is the result of an interaction of agents, environmental factors, and host factors, all of which are impacted by husbandry and management. I, as a veterinarian, get way too many questions that somebody thinks they've found a superbug that no one else has seen before and hasn't been described, and that's the source of all their problems. It's a bug problem. No, it probably isn't. It's an interaction of all three and it probably ties back to husbandry and management. And that's why I'm going to spend very little time talking about treatment and those kind of things, because if you control the host factors by getting adequate passive transfer into them, and you control the environmental factors, then these become inadequate to cause disease in and of themselves under nearly all circumstances. So what do I mean when I say you need to control the environment? Minimize the exposure. As I said, even with adequate passive transfer, those calves are not bulletproof. You still have to protect them. They are still very immunologically susceptible. And an important feature of that is that older calves are great amplifiers. Cows are always going to harbor these agents, but they tend to shed them at relatively low numbers. Then a calf picks those low numbers of exposure up, and they're immunologically naive, so that agent gets a foothold. And that calf then sheds larger numbers out into the environment. That calf may not become ill, but it's shedding large numbers. The next calf that enters that environment is now exposed to very high numbers, and that calf is at risk of becoming ill. So older calves serve as amplifiers. That's the basis of the Sandhills calving system. Permutations and variations have been mentioned regarding that have been mentioned throughout several of the talks over the last couple of days. And this idea is why those are so critical. That if you can get those calves out of a contaminated environment or keep them out of a contaminated environment, then you make all these other things much easier to achieve. Ideally, those calves are less than 14 days of age. There's a less than 14-day of age range within a pen. That has to do with how quickly that calf is likely to pick up an agent, how quickly that agent is likely to replicate inside the calf and get shed into the environment. Ideally, you'd like to have it under 14 days of age, but there's obviously you can only manage things so intensively, so 14 days is a pretty reasonable number. If you do have calves that are getting ill, it's going to be preferable to isolate them or separate them from more susceptible calves, because again, they're contaminating the environment, which is going to create an exposure risk for other calves in that same area. The other part of environment is cleanliness. Now, confinement environment, that becomes a struggle. Cattle, having clean environment for cattle, period, is a struggle. Becomes more difficult if you put them in a confinement situation. But you need to do the best you can. And so grass is going to be a better environment to calve in than dirt, which is going to be better than mud, which I have as an acronym from D. Whittier of manure, urine, and a little bit of dirt thrown in just to make it all stick together. But you know, that's the worst environment that you can have. And again, no matter how well you're managing colostrum, that's going to overwhelm that calf. So I have the little bullet here, prioritize pairs when considering yard drainage. Just trying to keep them from getting all the downhill sludge coming from wherever else. Other interventions, care of the umbilicus. The umbilicus is a direct path to the bloodstream. That's where all the nutrients came from in mom and where all the waste products went out. And so it's an amazing phenomenon to me how quickly the calf is able to wall that off, shut it off, and live in a dirty environment, but it's not an impervious situation. So if the umbilicus gets exposed to bacteria or to pathogens, you have the opportunity for sepsis, where bacteria are actually circulating in the bloodstream, making that calf ill. You have the opportunity for internal abscessation at the liver, at the urinary bladder, or very locally. Any of those can happen. And you can eventually have an umbilical hernia where the body wall failed to close around that because there was a localized abscess there. This is really bad. If this is the only way you diagnose an umbilical infection, you're missing lots of umbilical infections. We'll talk about that later as far as monitoring. But I think a lot of folks assume that, well, I'm not seeing very many of these. Well, good, you shouldn't. I don't care what environment you're in, you shouldn't see a lot of those. You need to be looking more closely in order to find the more nuanced ones. How can we minimize those risks? The major approach is environment, try to keep them in a clean environment as possible. B, some sort of nasal treatment. Desiccate the tissue, get it dried out to where it's not going to support bacterial growth. That's a major thing. Reducing contamination is sort of a secondary pursuit with that. There's a number of products out there. Work that's been done so far says they all work pretty well. So just do something that's going to desiccate that tissue, aid it getting dried out, and put a little bit of a barrier to the bacteria, and you can reduce infections by as much as 2/3. How you go about that, the suggestion is generally that you trim excessive tissue, and it's highly variable how much is there, but if you're going to dip, trimming that is good because you're getting rid of the extra length and you're reducing your contamination of your dip, and you're creating a new clean surface that you're going to decontaminate. If you're not going to dip, don't cut. Give the bacteria as long a path as possible to have to climb up. But if you're going to dip, go ahead and cut that, and you're going to have a little better success with that. You can dip or you can spray. Regardless of what you do, ensure that you get adequate coverage as early as possible. If you're dipping, make sure you clean those cups and you empty the excess. There are bacteria that will live in 7% iodine, and you don't want that bacteria inside a calf. Okay? That's the kind of bacteria that will kill a calf really quickly. So you need to take care of this equipment because, again, you are now putting this directly into contact with that calf's bloodstream, and it needs to be clean and free of contamination when you're doing that. Other interventions, vaccination, the solution doesn't come in a bottle. That's my take home, okay? It doesn't, because the solution doesn't come in a bottle. You can vaccinate dams for scours. It's wildly popular. Lots of people like to do it. The evidence is not terribly overwhelming in my mind, but there's certainly no detriment to it if you have the opportunity to do that. Vaccinating calves, use of a respiratory modified live virus for those yards that are having respiratory disease in very young age calves. There's some anecdotal evidence that says that works, and there's definite evidence that it's not harmful or detrimental. Intranasal is better than an intramuscular, so you can get an Enforce 3 product, as a product made by Zoetis. Zoetis is good at giving away hats, so we should support Zoetis. That's a product that Zoetis makes, but there are others out there that work as well that do seem to work at minimizing the emergence of respiratory disease in those young calves, and you can do it as early as 1 day of age. I have very limited enthusiasm for the vaccine products that you actually administer a modified live enteral pathogen to the calf. In other words, you give them a modified live rota or coronavirus orally, and then they're supposed to respond to that. If you're doing that, they tell you don't give them colostrum right after that because the colostrum is going to interfere with the absorption of the modified live viruses. To me, that's just way too much work and way limited benefit. I don't advocate using those. If you think that you need to vaccinate for scours, you need to be vaccinating the dam. All right, going to have to pick up the pace here a little bit to try to stay within my allotted time. But monitoring, I think, is very, very important. So how do you go about monitoring? What's it mean to monitor dystocia and calving issues? Well, you have to track it, first of all. You have to hang numbers on it. And so I would encourage you to document dystocia and break that down between heifers and cows, because, again, heifers are going to have more issues, both from a fetal-pelvic mismatch issue and just from the idea that they don't know. So separate it from heifers and cows. Document your number of stillbirths. If your cowboy or your pen riders say, you know what, we're not seeing the cow in labor, but when they do finally spit the calf out, it's dead, that's probably a failure to progress issue. That calf coming out of the cow dead is without a major, dystocia that obviously justified intervention. That's a failure to progress issue where your cows are not doing what they should do. Easy pulls versus hard pulls. And this relates to the train and retrain. If you have lots of easy pulls, your cowboys may be saying, we're doing a great job. We're staying right on top of this, and we're getting calves out, and they're doing really well. What they're probably doing is they're probably over pulling. They're intervening when they don't need to intervene. So you shouldn't have too many of those easy pulls, And the reason where that becomes an issue, A, it's a waste of labor, but B, you're probably also interfering with the natural progression of labor by getting into the pens and disrupting things too aggressively. So train, retrain, make sure they know what they're supposed to do, when they're supposed to do it, and what they're supposed to be looking for, then monitor and see how well they're doing. Say, know the averages. These aren't laws. It's going to depend on the population you're dealing with, but generally there ought to be less than 2% of dystocias in mature cows. If you're seeing more than that, then somebody's probably doing something wrong somewhere. Monitoring for failure of passive transfer. The easiest, most straightforward way to do that is through serum total protein. I have some notes in the proceedings that tells you basically what you should, how you can do that. It's really straightforward and easy to do. If you're not doing it and you're calving a large number of calves, I would encourage you to start doing that. It gives you a real good assessment of how your cows and calves are doing with achieving passive transfer. Serum is preferred over plasma because plasma becomes a little harder to interpret, but that's just a technical thing that you have to get the right tubes that you're going to use. Collect from healthy calves 2 to 5 days of age. If you're bleeding calves at birth, guess what? They haven't gotten passive transfer. If you're bleeding them at 12 hours, they haven't absorbed all that they've taken in. If you're bleeding them at 24 hours, they haven't absorbed all they're taken in. So we say 2 days of age up to about 5. After you get over 5, they've absorbed all of them, and they're actually starting to go down depending on how many pathogens they're encountering. So 2 to 5 days of age in healthy calves. Don't waste your time monitoring total proteins in sick calves. It's going to be really hard to interpret. This needs to be something that you're looking at on a herd level basis and looking at how you're doing with what appear to be healthy calves. All it requires are hematocrit tubes, which are really stupidly cheap, a benchtop centrifuge, which will last you forever if you take even remotely decent care of it, and then a refractometer, which is very cost efficient, and then a little bit of training and a little bit of labor. But this is something that is very practical to institute as a herd monitoring system, and I would strongly encourage you to think about doing that. How do you interpret it? We don't really know. This is the extrapolations from a dairy situation as a 5.5 grams per deciliter being achievable. How do you see 5.5 grams? It shows up on this marker. The refractometer actually shows you this is serum protein, and you can't read these numbers very well, but 0, 1, 2, 3, 4, 5 is going to be here, and it's 5, 6, 7. So this calf, if this is assessing a calf, that calf has failure of passive transfer. It's not rocket science. It's not hard to do. Anybody can do this. You need a refractometer, you need a light bulb, and you need someone who's not colorblind. That's all you have to have. 5.5 as a target, that's a minimum. That is a minimum. We know we can hit that very readily in dairy cattle. They've verified that you can hit that in beef cattle as well. My experience says you can do a whole lot better than that, but that is a reasonable minimum. Assess and interpret on a population basis. Again, we don't have a great target for this, but making some extrapolations, I strongly believe that less than 10% of your calves should suffer failure of passive transfer. So again, that's you interpret this on a population basis and say if we have more than 10% of calves having failure of passive transfer, either we have a quality, a quantity, or a efficiency issue, and we need to figure out which of those three it is and go about addressing that. How do you figure out whether it's a quantity, quality, or efficiency issue? Well, you can go and assess colostrum quality as well. Why would you do that? Probably because, like I just said, you found you have a failure of passive transfer problem. But you can potentially do that in a proactive manner, and it's certainly something we can employ as a research tool as well as we're trying to figure out how these nutritional manipulations impact colostrum quality. How do you go about doing that? You have to collect a colostrum before the calf is suckled, and then you use either this, which is a colostrometer, which just buoys in the colostrum depending on the density of the colostrum, or you can use a Brix refractometer, which is the same thing that we talked about right here. It's more expensive, but it's dual purpose, and it's certainly a worthwhile investment if you're handling a decent number of these animals. The colostrum's a lot cheaper, but it requires temperature control of colostrum because density of a liquid changes with temperature, right? And that's all we're measuring with the colostrum is the density of that liquid. How do you assess what is good enough colostrum? Again, very limited work that's been done in beef cattle, mostly from dairy cattle, and we know that dairy cattle make a lot of colostrum, so their quality is lower than what beef cattle are going to be. The colostrometer is real straightforward to read. It's got this red zone that says bad, and it's got this sort of yellow zone that says eh, and then it's got a green zone that's good. That's very straightforward to interpret. But those are made for dairy cattle applications. And so they have a relatively low bar to say good quality colostrum because, again, dairy cows just aren't going to be as good. So if you're using that low green mark, then you're going to have to feed a larger volume. So up to 10% of the calf's birth weight or body weight, which is a relatively large volume, right? That's a gallon of milk for a gallon of colostrum for an 80-pound calf. That's a lot of milk to get into it, and that's what you're going to have to be looking at. If you're looking at beef cattle, the work that's been done in beef cattle shows that beef cattle may be twice as concentrated as dairy cattle, and so I think you probably should have some different benchmarks as far as what you're looking at, but you can establish your own as you go through with the monitoring system. Umbilical infections. Why would you assess this? Because it's kind of an overall holistic indicator. It's going to tell you a little bit about the environment in which they're born, a little bit about their failure of passive transfer status. It's going to certainly comment on how effective you are at managing your naval care and those kind of things. Same kind of thing, though, as total protein. Don't just look at it on sick calves. You're going to find lots of naval ill in sick calves. Going to be highly correlated. It's not going to tell you a whole lot about your population. You need to be looking at it on a population basis, and a target of less than 5 calves should be a very reasonable target. How do you do that? What's that look like? You got to touch the calf. If all you're doing is looking over the fence and saying, oh, I'm not seeing any big navels, you're not monitoring naval health. You have to touch a calf. Obviously, you're not going to do this for all of your calves. You're not going to do it for a large percentage of your calves, but you ought to do it for some of them to have a better feel of it. Enlargement, any notable palpable knot after a couple of days of age is a problem. Again, it's remarkable how quickly this structure diminishes and should not remain detectable really outside the body. If it is, then there's probably something going on. If that animal responds to pressure, that's painful and that's a problem. And in older animals, if you find a defect in the body wall, that says they probably had an infection there when they were younger. They've now cleaned it up, but the body wall didn't close like it should have, and now you're going to have an umbilical hernia. Treatments and management, going to run through real quickly and we're done. Scours, it's typically a multi-etiologic agent. I'm floating my institution under the bus here. Odal's right outside the door. They got good candy. Go get some of it. But I'm not going to advocate you send a bunch of scouring calf samples to a diagnostic lab. They're going to tell you got Rota, you got Corona, you got Crypto, you got E. coli, you got Clostridium. Who cares? It's the same bugs all the time. It's a management issue in almost all situations. Treat the calf, not the bug. Make sure that calf is hydrated, get fluids into it. Orally works fine if they're not terribly depressed and compromised. If they are, then you need to be going sub-Q or intravenous. Use antimicrobials only if you believe there are bacteria circulating in the calf. If that calf is just dehydrated because it's losing lots of fluid out the back end, antimicrobials are not justified. Oral antimicrobials are generally of limited value. It makes you feel like, well, I'm topical treatment of the microbes. You're really not. Honestly, if you want to treat anything orally, you're better off to do probiotics. Put more microbes in there rather than trying to kill what's already there. You're going to have better success. Just feed them yogurt or commercial probiotic product rather than putting antimicrobials down them. Prevention, much more important. You're going to have to look at environment, pathogen load, passive immunity. That's why we spent the first 42 minutes talking about that and 3 minutes talking about this. Respiratory disease, the various pathogens involved, Pasteurella meltasta and Mycoplasma bovis are much more commonly encountered in younger calves than Mannheimia. But you'll also see salmonella, you'll see E. coli, you'll see other non-traditional respiratory pathogens. That tells you that those bugs ended up in the lungs by getting into the body, into the calf's body. They're not respiratory pathogens. They didn't get to the lungs through the nose, through the pharynx. They got to the lungs through the bloodstream. So if you're sending these to a diagnostic lab and you're getting E. coli or salmonella, you have a sepsis issue. That calf had bacteria circulating in its blood before it died, and that's the issue. Look at the management issues first, so it's the same kind of thing. Look at environment, look at your naval care, look at your passive transfer. Consider the microclimate that compromises calves' respiratory defense mechanisms. Sometimes folks think calves ought to be nice and warm and cozy. They need to have airflow. If they're living in, if they're in a hutch or something like that, and they have a lot of ammonia there, that compromises the respiratory system pretty quickly. So look at the microenvironment where they're residing. The playpens was mentioned yesterday. I think that's a great idea, but you have to get in there and clean it out and make sure that you're not creating a dead airspace that has a lot of ammonia and a lot of noxious compounds that you're basically encouraging that calf to breathe. Typical therapies should be successful for typical pathogens, P. mult, mycoplasma. If you're having a failure to respond, you probably don't have a superbug issue. You probably have an environmental / failure passive transfer / naval issue. So look for other issues if they're not responding. Wrap it up. I certainly believe you can be successful raising calves in as an intensive environment as you can conceive of, but it's going to require management intensiveness as well. So delivery of that calf should be rapid and uneventful. Then you want to get good quality colostrum at an appropriate volume into that calf as quickly as possible, manage the environment, manage your navel, and most of these issues are going to go away. It's not a superbug issue, it's a management issue.